And now, as he's launching a campaign to help raise awareness, Lee joins us alongside Professor of Medical Oncology, John Radford. Good morning to both of you. Thanks.
Good morning. Thanks for having us on.
It's lovely to
Lee, we've interviewed you, me and Kat, over the years in the 90s and the noughties.
Back to the 90s today.
Isn't it crazy?
Never had any idea that you had been through such an extraordinary medical challenge, which started as an 8-year-old. What do you remember back then when you first got diagnosed?
So, yeah, just before my 9th birthday, I remember always coming home from school, just fatigued, constant fatigue, and then my mum noticed a lump just under my jawline there, and we went back and forwards for about a year until we got diagnosis of Hodgkin's. So it was kind of a long process, but it was just a lot of fatigue, even kind of loss of appetite as well was something that I remember.
So once you get that diagnosis as well, I mean, you were just 8, nearly 9 years old, so I'd imagine that it was all quite overwhelming, didn't really understand the implications of it. What was the process then with regards to treatment?
So, I mean, yeah, it was a traumatic experience at that age, losing your hair with the treatment. So I had treatment chemotherapy. I can't remember how long it went on, but I just remember being in Newcastle Hospital in a cubicle. It was kind of an isolating time for me back then. And it changed my life. It really did change my life. And then 5 years later, it then kind of relapsed again.
Yeah, it came back.
So the second time you were almost 15, right then?
Yeah.
What was that experience like for you? Were you almost stronger because you'd been through it one time before, or was it harder for you?
It was actually harder psychologically, I think.
I'm sure, because you're a teenager.
I'm growing a bit. I'm a little bit more aware of myself.
Yeah.
I was always checking myself after the first time for any lumps and stuff like that. But yeah, it really, I think the way I saw myself was the biggest problem going forward, and that went forward into my adulthood, into my days in 911 and stuff like that as well. And there's little bits still that kind of affect me, but I've accepted stuff, I manage stuff a bit better than I used to do.
But that process, when you're suddenly at school and you're going through, as a teenager, when you want to be meeting girls and boys and you want to be going out and having a great time, and then suddenly you're going through this really brutal treatment again, that must have been really tough.
It was really tough, and I kind of blocked the world out, really. I didn't really go out and stuff like that. I was literally isolated, either in hospital or when I was kind of able to go home and stuff. I stopped myself from going out because I'd lost my hair and I didn't want people to see me. And I hated the way I looked. That was it. I was skin and bone and with no hair, so
it was tough. I mean, it's so testament to you that by the time you'd sort of been healthy, you'd been cancer-free for a while, you got yourself healthy, and then you wanted to get into a boy band. You wanted to perform. You wanted to be a singer.
I did. I loved Take That. It was my inspiration to get into 911. And I had no idea how to do it, but luckily there was a couple of guys called Spike and Jimmy, and they were looking for a third member.
Didn't you write into a radio station
exactly
or
what I did.
something like that? It was like...
Yeah, my local Carlisle radio station at the time.
And so do you know anybody...
Yeah, you've got it, you know that.
Yeah, anybody looking for a lead singer?
That was it, and they passed my details up to the manager in Scotland who was looking after the lads, and that was it. We were the same, we're quite small, we're about 5'5" each, and it just kind of worked.
It worked. And you're all clear now?
I am all clear now, yeah. There's a few things that have kind of happened along the way, but I'm fit and healthy and living life to the full. It's taught me resilience and lots of things, strength, you know.
And are there any other repercussions?
So the main repercussion for me was finding out 20 years after my recovery that I couldn't have children, and that was a huge blow.
Because of the treatment you
Because of the chemotherapy, yeah. And that was a huge blow. But it's something I've come to terms with over the years and I've accepted, and, you know, I'm alive, and that's the main thing.
John, it's brilliant having Lee here. Yeah. As Kat and I knew him when he's in his pop star days, the heyday of the boy band, and he's still with the boys now, had no idea. He was always a picture of health. Yep. Jumping around the stage, performing.
Curtains.
Yes.
Fantastic to see that you can recover, but what you want to be is very conscious of letting people understand what are the symptoms we should be looking out for.
Well, I think first to say, Lee's story is very powerful, and it just actually shows what a big impact having this diagnosis and going through this sort of treatment has, especially on a young person. And Hodgkin lymphoma is the commonest cancer in young people. Overall, it's quite a rare condition. 2,500 new cases a year. Typically, people find a lump, and you found a lump in the neck or under the arm or in the groin.
In the lymph
These
glands.
are the lymph glands that have enlarged as a result of the tumorous process. But the thing to remember is that it's not just about lumps. So you mentioned, Lee, as your first symptom, tiredness. And I think that that is a very important symptom to be aware of. Also significant weight loss, loss of appetite, drenching sweats at night. And in fact, Hodgkin lymphoma can present in many different ways. And I think the message is, if you've got symptoms that persist for more than a couple of weeks and are not self-limiting, you need to get those checked out. Now, if you've got a lump, then that makes it a little bit easier because there's something there that's clearly
Physically,
abnormal.
you can see,
Physically, it's there. And, of course, you then had a biopsy and the diagnosis was made. So I think the message that I'd love to be able to sort of underline is the importance of getting things checked out if symptoms persist.
Yes.
And, of course, if there is a lump present and people, as it were, feel in the neck and under the arm and in the groin, if there's a lump that persists for more than a couple of weeks, get that checked out.
Yeah.
Most causes of an enlarged lymph node are infection, and that will go away. So most people with lumps, it's not due to lymphoma, but in some cases it will be, and that's why you need to get it checked.
Can I ask you a question? How do you physically do it? How do you check? Is it just pressing under your jaw?
So the recommendation is with the flat of the hand.
Yeah.
And with a circular, gentle movement, feeling in the neck,
Yeah.
behind the collarbone, the clavicle,
Yeah.
under the arm, and in the groin.
Okay.
Now, of course, lymph nodes are throughout the body, so you can't feel those in the abdominal cavity or the chest cavity. And, of course, those can cause symptoms in their own right, such as abdominal pain, or it might cause a cough persistently or shortness of breath. So, in other words, there's no specific diagnosis. And it goes to that point about if there's symptoms that persist, get them checked out.
And interestingly as well, if it is caught early enough, it is eminently treatable. But also the other thing is there's an impact to some of the treatment, understanding, because Lee didn't really know when he was 14 or 15 that this treatment could well make him infertile.
And Lee, that point about finding out about infertility later is devastating. And that's one of the late consequences of treatment. There are other late consequences that people need to be aware of, and the sorts of things that we can do to mitigate those, such as screening, lifestyle, other medical interventions, which underlines, again, the critical point for people like me these days is to try and devise therapies that are effective but less damaging.
And for the patients
And
to
for the patient.
communicate with their doctor.
Exactly. And this is all about dialogue and talking doctor and patient, patient and doctor and carers so that the best outcome can result. And finally, the importance of research and clinical trials, because without that and pushing the boundaries further, we can't advance.
Yeah.
Well, it's great to see you looking so well.
Thank you so much.
30 years next year.
30 years next year, so we'll have a chat and see what's
Will you come back
happening.
and tell us about your new adventures
You'll be the
next
first
year? 'Cause
one.
I've got a feeling there might be something
There's
big.
a little video that we've been showing, the first little clip of you, and it's the boys, you're singing, and it's the boys doing a strange little hippie dance thing. Is it? Which bit is it?
That's
I don't think
the other one.
It's the other one.
Oh, it's the other one. What is that?
And
Body shaking, is it not?
Yeah, exactly. And
Is
Cat
it?
seems-
You've got my body shaking.
You've got my body shaking.
Watch this, watch,
Hold on, there you go.
wait.
Is it this?
Hold on.
This bit? No.
No.
It's where the boys get their hips going.
They
So we haven't
really-
got quite the bit. I tell you what, Kat has been literally talking
Learning
about it
it.
ever since she's seen it.
I have, yes.
Could I-
Reminds me of... Go on.
Sorry, could I just mention that the charity is Lymphoma Out Loud?
Yes.
And the campaign, which I'm now ambassador for, is Know Your Nodes.
Brilliant.
Great.
Lovely
Thank
to
you
see you.
so much.
Thank you, John, for
Lovely to
joining
see
us.
you.
No,
Oh,
thank
hello.
you.
Thank you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.